Yes.
And it is very much a kitchen table issue. One of the results of that for small families starting out, is they're not having children. So the birth rate is declining. And we've spent so much energy in our country talking about coverage. We've done nothing to address the cost of actual healthcare consumption tied to outcomes. So personally, as a woman and a matriarch, I'm looking at my kids and saying the outcomes for U.S. women, we are at the bottom of the industrialized globe in terms of our outcomes, maternal outcomes. The racial disparities are terrible in Missouri and portions of Kansas. What do we do to attack that? And it's interesting because we have a very bimodal policy when it comes to maternity coverage. You probably have more to say as an employer,
Right.
and the impact with the insurance plans and healthcare delivery as much as the federal government. How do we apply that to Medicaid? How do we make a difference? You can tell, I got a lot of it.
I got it.
I got a lot of thought about this. I want to make a difference.
How old are your children?
I have a 15-year-old and a 12-year-old.
Okay. You've asked a lot of questions.
You can pick
So, in the interest of everybody, let me try and frame the healthcare crisis first, and then talk a little bit about what I would try and do to fix it. Is that okay?
Yes.
First off, I'd like to say that I grew up in a family when I was 7 years old where we lost health insurance, and it scarred my family, and it broke the family fracturing of the American dream. I witnessed it, and it scarred me. And so I know the shame and the fear of not having health insurance, and that's why it was so important to me when I was building Starbucks to try and build the kind of company my father never got a chance to work for. He was a blue-collar worker, and he fell on the job, fired, no workman's compensation, and that was it. And so I understand this. Also in terms of gender and paternal, gender pay and paternal leave, Starbucks has been the leader in 12 to 16 weeks, so I'm pretty proud of that. Healthcare. So I was a strong supporter of the Affordable Care Act on the basis of one thing, and that was trying to cover 20 to 30 million Americans who did not have health insurance. So I thought it was a very good idea. Like many ideas, it wasn't perfect. And it's proven over a 9-year period to be imperfect. Primarily, that the premiums are now up 2x what they once were. And so the typical American family of 4 is facing a huge challenge in their inability to pay for the premium. So there's 2 issues about healthcare. One is access, and the other is runaway cost. So access, I believe that every American, regardless of their station in life, should have access to affordable health care. And what I would do to try and reduce the premium problem is the following. And we're going to get into something that many Americans don't know much about, which is the inside game between pharma and the United States Congress, which I'll get to. Is we need more transparency in the system. We need more choice in the system. We need interstate commerce among insurance companies. All of that designed to reduce the cost curve. But the big opportunity to reduce the cost curve, which is not in place, is universal catastrophic coverage. So 100% of the American people would not be facing insolvency if they got cancer or heart attack or, God forbid, something really bad happened. That does not exist today. If we had that, the premiums would begin to come down. But there's a secret within the healthcare system. That's not such a secret because people are starting to talk about it, but the secret is that the pharmaceutical companies and the United States government do not negotiate drug prices. So,
Not allowed to.
not allowed to, which is, how is that possible? Why are we not allowed to? Do you know the answer to why we're not allowed to was revealed a week and a half ago during a Senate finance hearing where the senators got together in that room on television and they had the executives of pharma being interviewed. And they were asking good questions. And then someone did a little research and they found out that $9.5 million of lobbying money was lobbied from the people being interviewed to the senators asking the questions. So what incentive whatsoever, other than for show, do they have? And on top of everything else, to make matters much worse, the same exact drugs are sold in Europe at a 40% discount. And so this is a perfect proxy for what I'm saying. And the proxy is that the two parties are complicit in their ability not to represent the American people, but their own self-interest. The healthcare system in America, the amount of money we're spending, can be solved. But it can't be solved where both parties are unwilling to do what's right for the American people.